Across Somalia, large numbers of children continue to suffer from malnutrition, caused by illness, lack of adequate appropriate food, unclean water and poor sanitation. But an innovative community-based approach in Barao town, Somaliland, mainly funded by the European Commission's Humanitarian Aid and Civil Protection Department, ECHO, is helping to tackle the cause of malnutrition and provide early intervention for those showing it. At a busy maternal and child health clinic, women queue to receive treatment for their malnourished children. Nemo Ahmed has brought 9-month-old Najma to collect the weekly supply of peanut-based therapeutic food. 2 months ago, Najma was suffering from diarrhea and severe malnutrition.
The baby fell sick and as a result she became malnourished. When I brought her to the health center, they put her under the therapeutic feeding program. Since she started eating the peanut paste, she has improved.
UNICEF and its partners are reaching out to families in remote areas. MEDAIR, a UNICEF partner in Somaliland, sends teams of health workers to rural areas to actively seek out children suffering from malnutrition and provide a package of basic nutrition services.
We have treated 90% of the children who was in the community and severely malnourished at that time, and we also give them an opportunity that they can help their other children at home to do prevention things, and with that sort of things has improved, and the number of children that was coming to us is reduced, and we continue mobilizing them, we continue reaching house by house, we continue teaching them.
UNICEF and its partners are increasingly using community health workers to educate families on how to prevent malnutrition. Aisha Mohammed is the team leader of a community volunteer group. Today she's visiting families at Kusor camp for the displaced on the outskirts of Barao. She teaches mothers the importance of exclusive breastfeeding until the baby is 6 months old, appropriate complementary feeding practices after that age, and good hygiene and sanitation practices at home.
Malnutrition is a result of two things, hunger and diseases. If it is by disease, we tell the mothers to take their children to the hospital. And if it's by hunger, we tell them to take their babies to the health center to get peanut paste. If the baby is old enough, we advise the appropriate food to buy from the market and feed them well.
Across Barao town, Zainab Aden, a midwife, is holding a nutrition education session on infant and young child feeding with new mothers and pregnant women outside the maternal and child health clinic. The programme, organised by UNICEF's partner, the Somali Red Crescent Society, is promoting simple measures to help mothers to prevent their children becoming malnourished.
Firstly, we tell the mothers to give breast milk to the baby for the first 6 months of the child's life, and they should not give the baby any other food. The second thing is how to hold the baby when breastfeeding. Thirdly, when the baby is over 6 months old, you should start feeding him any other food and continue breastfeeding him. Finally, make sure all the black part of the mother's breast is placed on the child's mouth.
Diarrhea is one of the main factors causing acute malnutrition, as it leaves the child unable to absorb food. UNICEF partner, PSI, educates mothers on how they can prevent diarrhea through hand washing and good hygiene practices, and how to use oral rehydration salts and zinc if their child has diarrhea. This integrated approach to prevention and early treatment of malnutrition for Somalia's children is supported by the European Commission's Humanitarian Aid and Civil Protection Department, the Government of Japan, AusAid and the Saudi National Campaign for the Relief of the Somali People. Without such generous help, it's likely that many more children would be suffering from severe acute malnutrition and in need of urgent care. This is Susanna Price reporting for UNICEF Television. For more information, go to www.unicef.org. Unite for Children.